Greetings, Dr. David Webb, also known as Pain Man MD, coming to you, Georgia Pain and Spine Institute. Today, I wanted to welcome you and wanted to talk a little bit about hip pain. Hip pain is also a common cause of pain and a common disabling concern for many individuals, especially as we advance in age. First, I want to talk a little bit about the anatomy of the hip. So the hip is made up of what we call the femur, the acetabulum, where the head of the femur rests in, and the actual labrum that makes part of the hip joint. In this area, our ability to walk and our ability to pivot, utilizing our legs, all takes place with the hip joint, or as we like to call a ball and socket type of joint. The round head of the femur actually rests in the acetabulum, which allows the rotation overall of the limb. There's also the pelvis, which consists of the ilium, ischium, and also the pubis. These also make up part of the hip joint. Now, the hip joint also contains a very strong capsule or ligament. Within that ligament and surrounding that ligament, you also have various nerves, muscles, and blood vessels. Now, when we talk about hip pain, everyone usually wants to know, how do I know if it's hip pain versus something else? There's two types of injuries that could be related to hip pain: those that are intrinsic or occur within the hip, and those that occur to structures that surround the hips. Usually an individual that has intrinsic or internal hip pain, usually, and not always, but usually presents with pain that radiates into the groin and pain that is actually either anterior to the hip or felt within the hip. There are also pain that can be referred to the hip, and those usually occur with external structures such as muscles, such as nerves, such as other what we call ligaments. Many causes of hip pain. There's arthritis, such as osteoarthritis, psoriatic arthritis, rheumatoid arthritis, septic arthritis. There's also significant injuries that take place, and you see this in many athletes and runners, such as bursitis, hip fractures, and actual hernias and other areas near the hip that can cause referred pain to it. There's also one of the common causes of what we call hip pain is nerve compression, and that unfortunate pain notes with sciatic, or pain that radiates down the hip and down the leg. Then we also have, unfortunately, pain that occurs due to another site, such as cancer, where we can have bone pain due to metastatic disease. And a lot of cancers over a period of time will metastasize to that actual joint space. And then we have some rare things that can occur, such as what we call avascular necrosis, and also, as we get a little older in age, osteoporosis. So the next question is, how do we go about treating the hip, or treating pain that is caused, that we believe is caused by the hip? The first thing is, if you're having pain, is to incorporate RICE therapy, which is rice, ice, compression, elevation. In addition, if you continue to have hip pain, you need to see a physician and need to obtain some imaging, such as an x-ray, or if severe, MRI, CT scan, and other types of imaging. Now, one of the most important things is to incorporate is physical therapy. Physical therapy can help reduce some of the pain and potentially delay the progression of the either injury or what we call pathological disease state. And then, unfortunately, we may have to transition to injections. There are different types of medications, such as injections of steroids. There's also oral steroids that can be taken, and non-steroidal anti-inflammatory drugs such as ibuprofen or meloxicam can be used. And if, unfortunately, there's progression of the disease, one may need to have surgery. And that's when a surgeon will need to come in and actually evaluate and make a determination if a hip replacement or a more minor surgical procedure is needed. There are also alternatives. One specific alternative is PRP, or platelet rich plasma, that has shown some benefit and efficacy in reducing pain. There are many types of treatments, but unfortunately at times surgery may be needed. So overall, hip pain is a very debilitating illness, but it's not one that you should have to chronically suffer from. If you're having hip pain, I challenge you, give my office a call or come in, have an evaluation, and let's talk about how we can get this pain. I can be found at www.gapainandspine.com. That's www.gapainandspine.com. I'm Dr. David Webb, also known as Pain Man MD. Thank you for taking the time to discuss about hip pain. And again, if you're having any issues, please give us a call.